Move away from 5 o'clock, but I do just want to go ahead and get us started. We're really excited about this event. Thank you everybody for being here. So thank you for joining us in the next event at the Emerging Leader Speaker Series, presented in partnership with Benchmark Strategies. I'm Kat, and I'm the Associate Director here at the Massachusetts Women's Political Caucus, or MWPC, and I'll be one of your moderators today. The MWPC is a nonpartisan nonprofit organization founded 50 years ago. More than 50 years ago now, with a commitment to civil rights and reproductive justice. We work to increase the number of women in elected office and appointed public policy positions across the Commonwealth. We also seek to engage women of all ages in the political process through events, workshops, and exciting programming like this series. We're thrilled to partner with Benchmark Strategies, and I'll turn it over to Nicole.
Hi, everyone. My name is Nicole, and I'm the Assistant VP of Public Affairs at Benchmark Strategies. Benchmark is a Boston-based public affairs and public relations consulting firm, and we are proud to partner with the Massachusetts Women's Political Caucus on the fourth conversation of this series. And today we are excited to hear from State Representative Mindy Domb. Welcome, Representative. Thank you so much for being here tonight. If you would like to maybe introduce the audience a little about yourself quick, and then we can kick off the moderated discussion, that would be great. And for audience members too, please feel free to submit your questions through the chat throughout the conversation.
Thank you. And thank you so much for inviting me and including me in this late summer conversation. It's, still light out. It's still hot out. So we'll get a good conversation and still be able to be outside a little bit before we have tuck in ourselves for the evening. I'm Mindy Domb. I'm the representative for the 3rd Hampshire District, which currently includes the communities of Amherst, Pelham, and half of Granby, Massachusetts. And it's a completely Hampshire County based district. For those of you who may know the area, Amherst is home to 3 institutions of higher education. They're the University of Massachusetts Amherst, which is the flagship campus for the UMass system, Amherst College and Hampshire College. And we're part of a region that has many colleges and many private as well as public community colleges, as well as Smith College, Mount Holyoke College, and others. I'm finishing my 2nd term, which means I was elected in November 2018. I'm up for re-election this year, as is every other state legislator, representative, and senator. The primary, you may know, is September 6th. The general election is November 8th. I'm pleased that I don't have a challenger in either one at this point. But it's kind of a mixed blessing because I still need to ask, for every constituent's vote, because I'm still up for re-election, which is sort of the elected officials' performance review by our employer, who is the voter. And having a challenger sort of allows you to contrast what you're doing and kind of take accountability for what you've done in a different way. But I'm still out there doing it. And hopefully I'll get re-elected. I hope to give me one of these if I'm talking too long in the introduction. I'm on 4 committees this past session. They were the Joint Committee on Higher Education, the Joint Committee on Revenue, the Joint Committee on our COVID response, and the Joint Committee on the Environment, Natural Resources, and Agriculture, which is known by it's an acronym ENRA. I was appointed vice chair of that committee, and then in the middle of the session, our chairperson, Carolyn Dykema, who's a fantastic representative, resigned from the House to take a really terrific job in the private sector. And by accident, I became the acting House chair. I mean, by accident, meaning my accidental location to that position. But it was a fantastic experience. I'm still doing it, getting to really dig deep into a lot of bills that affect all of us in the Commonwealth, but particularly resonate in my district. Because it's not only has farms and agriculture out in Western Massachusetts, but we've got many environmental activists and people who are deeply committed to our natural resources. So when I ran 4 years ago at this point, I ran on a plan with, I was told I should only have 3 priorities. The people who guided me, who I respect, said, so what are your 3 priorities? And I said, I represent a district that has more than 3 priorities. And they said, you got to narrow it down. You got to narrow it down. So we can talk about this later in terms of running a campaign. So I had 3 top priorities, and then I had 3 sub priorities because I really couldn't cut it down. And my 3 priorities were public funding for UMass Amherst and for public higher education, income inequality and food insecurity, and the climate, and responding to the climate crisis. Those were the top 3. The sub 3 really are around sort of reproductive rights, immigrant rights, LGBTQ rights. And I'm happy to stop talking at us and take questions if you'd like. And I'm thrilled to be here, really thrilled. So thank you for including me.
No, thank you so much. That was great. Yeah, we can get started. So we actually have our first question related to food insecurity, because during this session, so you supported and sponsored a hunger-free campus bill, which for people who don't know, addressed food insecurity for college students in Massachusetts on college campuses. So we were wondering, as students prepare to return for a new school year, what steps do you believe the state can take to help alleviate hunger and food insecurity on college campuses? Especially as we know right now, food prices and living costs continue to rise.
There's so much that we can do, right? Because food insecurity is sort of its own thing, but it's also deeply connected to economic insecurity of all sorts, right? You mentioned some housing insecurity, the price of food, the price of tuition, the price of transportation. All of it is interconnected. So like our budgets are integrated. So when we feel pressure in one area, we end up sacrificing or trading off in another area. So whatever the state can do, quite frankly, in helping to stabilize the cost of public higher education is going to help with food security. That's the first thing. So what does that mean? It's not the state, but today when the president announced cancellation of student debt, that's huge because so many of our public higher ed students are receiving loans and are in debt. And that debt plays a role in what they can spend on themselves while they're taking classes, whether it's what they spend on textbooks, what they spend on food. So anything we can do to relieve the debt and to lower the price of tuition is going to help students with food security. But there are some really specific measures that the state can do and college campuses can do that can help student hunger. So this particular bill provides a framework for colleges to like a menu of options that campuses can choose from to decide what's the best way to address food insecurity on their campus. If they decide they want to start a food pantry, this bill will provide funding to help them start that. If they decide they want to do more with SNAP enrollment on campus and be able to get EBT machines, but they're not sure how to start, or there's a cost associated with that and they're not sure how to proceed, this will help them do it. So the bill itself sort of is a grant funding machine for public college campuses to be able to take some of these measures and do some of these activities that will address student hunger. But ultimately, what we have to do is we have to bring down the cost. We have to bring down the cost of tuition. We have to make sure that we look at students as complete people. And so they're going to have to take transportation. What do those costs look like? What are the costs of textbooks? There's some of you may know the organization Mass Perg. They're very active on campuses across the Commonwealth. And one of their key areas is to go electronic and to make sure that we use open educational resources, be able to use resources that are freely available on the web so that students don't have to spend money on textbooks. When I first moved to Amherst, which was now over 20 years ago, we had lots of independent bookstores in town. Now we only have a couple left, but we used to have a lot. And I used to go into the bookstores at the beginning of a semester, and they used to have all the books that students were going to have to buy. And I loved looking because I loved saying, oh yeah, I read that book, or I got ideas for what books I should read. It was a little bit of nostalgia of what I did read when I was in college, but they were enormous. They were already starting to skyrocket in terms of their prices. And about 4 years ago, when I would talk to one of the bookstore owners, I said, how are you adjusting for what the price of books are and the price of tuition? And he said that for the first time, they were seeing students come in groups to buy books to share. So there would be like 6 students in a class coming together to buy one book that then they would rotate and alternate. That's how much books cost. And I know that for a lot of people in my age range and older, we don't actually have a complete understanding of how expensive it is to go to school right now. So for example, when I went to college, and I went to a private college, room and board together, the whole year was $5,000. $5,000, that's not even a meal plan right now in 2022. So, if that's what the price differential is between tuition, you can imagine what it is for books, right? I could spend under $50 when I was a student to buy my textbooks. Now one textbook can cost several hundreds of dollars, and that's a meal. That's meals for a month. So we need to really sort of look at students as holistic folks, right? Just like everybody who's not on campus, but see all the economic pressures that they're facing and relieve them across the board. So the one piece of that is directly attacking food security. But the other way to attack food insecurity is to attack all these other economic pressures so that they can still have money in their budget to eat. I hope I answered that question. Nicole.
Yeah, no, that was great. And it's such an issue I think a lot of people don't realize and that we need to bring awareness to more. So it is good. And I also just have one more related to food too, because we also read that you advocated for ARPA funding for a mobile market in Amherst.
Yes.
I was wondering too, as a state, like how we can also continue to fight hunger across Massachusetts in like food deserts, like in Western Mass.
Well, I think that, there's a little bit of a disagreement within the hunger movement around how to respond to hunger generally, because it's such a systemic problem and it's the roots of it are in our entire society, right? And how do we really kind of get at the root versus help people in an emergency situation? And my background, before I became elected, I was the executive director of an organization called the Amherst Survival Center, which has, it's like a one-stop shop for basic needs services. It has a free food pantry, free meal site, free health center. It had a free store, a community program. And that has to be part of how we look at food security. We have to provide the food that people need on a regular basis, in addition to lowering the cost of tuition, et cetera. Tell me what your question was again. I think I got off track there when I started talking.
No, just how we can help across the state too and other food deserts, like what we can do as a state, I think.
So, in the budget, legislators have an opportunity to kind of put in amendments or earmarks for local priorities and local investments. And so some of these investments are mobile markets. In the one in Amherst, it's a bicultural, bilingual mobile market. So it really is sort of seeped in the Latinx community, which is incredibly valuable. It's not only kind of closing a gap for a food desert, but it's also closing it for a particular population group that otherwise would not receive those services. And we have food pantries that kind of close that gap. We have a lot of places that don't have supermarkets. In Springfield, which is like the third largest city, they don't even have a supermarket in the city. So we have to be able to look across the state and say, where are those food deserts? Who's already doing some of the work of trying to meet that need? And how can the state be helpful? I'm not one that believes that the state should come in with a big foot and say, this is how we want you to do it. The work is already happening throughout the Commonwealth. We need to be there to be the backstop and the banker. We need to be able to fund it. And we need to be able to do that in every level. So that's, whether it's the universal school meals, which the state is doing now for next year in schools, so that every student gets free breakfast and lunch. So important, not only for student success, but to dismantle stigma that's attached to hunger. So no student has to say, I'm hungry in order to get food. We just say everybody should get food. That's part of learning and part of the way we're going to help you be successful. So the state to do that, to just say, we're taking care of that. I mean, what a relief for these districts not to have to worry about that. And then there's other places where we're going to have to even do more. We already fund a budget line called MIFA, which is the food line that supplies food banks with food. We need to do more because people need more food. When I was working at the Survival Center, and we were very generous, we had a very generous pantry. We were providing food per household for about 5 to 7 days a month. But guess what? Months have 30 days. So what do people do for those other days? We need to call upon our best angels and our best generosity and recognize and embrace that food is a human right. And as such, the state has an obligation to make sure that people have access to it. If I could just say one other thing about what I was talking about before, this puzzle piece that's in our lives, right? It can be our income, how much money is coming in, what our rent is, how much food is, what our transportation costs are for students, how much their textbooks. Another issue that I'm very involved in is diaper need, because that's another piece of that puzzle that for young families, diapers can be enormously expensive, and they're not covered by SNAP or WIC or any of the food programs. So they end up being sort of this extra unbelievable burden for families. And so I'm also involved with trying to get the state to help supply diapers to food pantries and diaper banks that already exist across the state so that they can distribute more to people who are in need.
No, that's great. Yeah, diapers are very, very expensive, as I know from my sisters with my nephews and nieces. So definitely understand that. Okay, great. Well, Kat, I know you have the next set of questions, so I'll let you take it over. You want to ask?
Well, thank you so much. And I learned so much. I've learned so much already in this conversation. We do want to chat about the environment. You're, of course, chair of a very important committee, and your provision, and the Landmark Climate Bill, the Green and Healthy Schools provision, passed with great support. So we want to hear a little bit more about that. Why is it imperative that we assess our school building portfolio? And why is it important to make sure that every community in the Commonwealth has access to healthy building and learning environments for students and teachers?
Oh, it's such a good question. And thank you for your interest in this bill. I sort of am a follower on this bill. Although I was the House filer, I would like to say that the main leader in the legislature is actually my Senate partner, Joe Comerford, who also happens to be my state senator. We share Amherst and Pelham at the moment. So, and Senator Comerford got this idea from one of her constituents, who's not one of my constituents, from Northampton, which basically, I mean, the premise is so simple, it's ridiculous in a way that we have to legislate it, but it says, let's create a set of universal standards for what would be a healthy green school. Let's set those standards, and then we'll use those standards to assess our inventory of buildings, and then we can start identifying what we have to do to make all schools healthy to live and to work and learn in. And the reason why this is so important is, a couple of years ago when we passed the Student Opportunity Act, which was one of the first kind of historic bills that I got an opportunity to vote for after being elected, there was this understanding that a child's education should not be based on where they live. It shouldn't be based on their zip code. That Massachusetts is a Commonwealth, and also based on our Constitution, we have an obligation to make sure that all students, regardless of where they live, are getting a high quality education, and that it's the obligation of the state to come in with funding and support to make sure that whatever difference there is, that gap is closed. And so we're looking at buildings as the same thing. And this is actually one of the ways that I think we can look at a lesson learned and a silver lining maybe from the pandemic, is that we realized that buildings play a role in health. Lots of people knew this beforehand. People who are advocates around asthma have known this for decades. Many educators and occupational health people have been pointing this out for schools for decades. But it was really the pandemic that sort of raised the bar for all of our understanding to realize that every school should have better ventilation, right? Because there was a key relationship between ventilation and weather and transmission of this virus. And so once you have that awareness that the building itself can play a role in student success and achievement, as well as individual health, then we have to make sure that every student has access to a healthy building to work and learn in. As key to their success, not just their personal health, but key to their academic success. So this bill, which was a standalone bill, got incorporated into the major climate bill that we passed. And, I mean, it was sort of a surprise to us, but not, because we're advocating for this bill to move. But how wonderful that it got sort of slipped in and then zoomed to the finish line. And so now we'll be working on implementation. This is the key thing with legislation. It doesn't end just because the governor either signed the bill or because he didn't sign the bill, but we enacted it anyway. it doesn't stop there. Now we have to make sure it gets implemented. And that's where our attention is focused now is, okay, we've already started to schedule some meetings with DESE, the Department of Elementary and Secondary Education, to understand better how we are going to go about implementing this legislation, recognizing that in January we'll have a new governor. And so we may have to have that conversation with the new governor as well.
Thank you so much for sharing, especially for highlighting both that it's legislation is important, but so is the implementation.
Absolutely.
We also wanted to ask, you mentioned earlier that you stepped up to serve as the acting chair of the Joint Committee on Environment on NRA, as you said earlier, and that happened in February. What was it like to take this leadership position during such a busy and crucial time in the legislative session and in a pretty busy session as well?
It was busy. Thankfully, the committee has a fabulous staff. You know, Rep. Dykma hired and had two fabulous young women who are committee staffers, who are very professional, very smart, and very eager to assist me and make it not easy, but to be able to really make it a smooth transition. So you may know that in the legislature, there's something called Joint Rule 10. And Joint Rule 10 is the day by which committees have to make decisions on bills. I think it's like the first or second Wednesday in February of the second year of the session. So that's your deadline. If you're a committee chair, you have to get as many bills out of your committee as possible. And as some of you may know, decisions about bills leaving committee are taken as a vote of the committee members. It's called a poll. And there's a couple of options for bills. They can either be advanced to the next committee, they can be sent, they can be killed, which very rarely happens, or they can be put to study, which basically is not really killed, more like going to sleep until the next session. Nothing really happens though with bills that go to study. But there's a fourth thing that can happen, and bills can get extended. So if you're not ready for a bill to make a decision on that bill by Joint Rule 10, you can request an extension for it. So by the time Rep. Dykma left, she had processed a ton of bills for the committee, but there were still about 50 bills that still needed to have decisions. And so that's what I got to do with the committee staff, with my Senate chair and with the full committee, was look at those bills. And it was an incredible quick education, which is one of the reasons I love this job, is because you're constantly learning, you're constantly being exposed to new issues. So if I may, I'll give you an example of some of the issues that we dealt with after Joint Rule 10 and under my sort of oversight for the committee. So I bet you didn't know there was such a thing as mattress recycling, but there is. And come November, there's going to be a ban on mattress disposals in the Commonwealth. And so we had a couple of different bills that looked at what we should do for mattress recycling. And so we dealt with those bills. We dealt with plastic bag bans. Should there be a plastic bag ban? How should it look? When you do a plastic bag ban, it's not just we're going to ban single-use plastic bags. It's also how much are we going to charge for paper bags? What are the fines going to be if someone violates it? And so we kind of dealt with that. We did advance a plastic bag ban. We also advanced a bill on something called extended producer responsibility. And this is the whole notion. This is sort of like what we do with bottles and deposits. The company that makes the soda actually takes the responsibility, right? We pay a little bit more of a deposit, but then they take the responsibility for recycling it and doing all the other information with it. And extended producer responsibility is what we're looking at for to-go containers and other kinds of plastic utensils. So we did a big bill on that. There was a bill around banning the release of helium balloons, because when helium balloons get released into the atmosphere, after they get released and they fall to the ground, they often fall into the ocean and they kill turtles and other marine life. And so we did a bill around the release of helium balloons rather than banning helium balloons altogether. The bill, as it left committee, banned the release, the intentional release of helium balloons. And so those are some of the kinds of issues. We dealt with forests and how to protect them, agriculture, farmer equity, issues like that. Really interesting. I call the issues that come before ENRA, they're an onion. You think it's one thing and you peel off the layer and there's another layer, and then you have to learn about that, and then you peel that and there's another, and there's many layers, because it's not just, is it good for the environment? Is it bad for the environment? It's also, how is it good or how is it bad? Who are the stakeholders? What are their positions? And you go from there.
That's a really broad sort of range that's coming before you. I want to just ask one question from the chat before we move on. So, question from Dawn Chu, who is on the MWPC board. And her question is, for a school system asking the Mass School Building Authority to look at their elementary schools, this is tying back to our first question about the bill you passed, how does this bill change their possible outcome? So specifically, the elementary school in Salisbury, Massachusetts serves some of the poorest children in the state, but a hard rain makes brown sludge pour down the walls. So how does this bill sort of change the outcome for that community?
So my question back is this in the context of asking to MSBA for money to fix the problem or to build a new school? I'm from a community right now where we're in the middle of trying to design and build a new elementary school that we got MSBA funding for. So there's that track at MSBA. And I would think if you were looking for money to build a new school, once this bill is implemented, it will give you the foundation for what you need to do in terms of ventilation as well as healthy schools. And you could build your school according to what these standards would say. And you also could then use them as a way to contrast them with your existing school and say what needs to be fixed. If a school system was thinking that they wanted to seek state funding to address a problem in their school, I think it would probably work the same way. Once these standards were set, if it turns out that that school is coming below that standard, we'll have to look at it, but that might be future legislation to create a grant or a pool of funds that would allow towns to tap into those funds to close the gap between what they are facing in their school and what the assessment says they should. Too many times these kind of issues are foisted really on municipalities to cover the complete costs. And I don't believe that's fair. I think this is a key place where the state can be helpful, is on these capital projects that directly affect sort of these social goals. And so, we bond for this kind of thing, and we should be able to bond to make sure that our schools are healthy and green.
Absolutely. Thank you so much. I'm going to turn it over to Nicole for our kind of next set of questions. But folks, please feel free to keep putting questions in the chat. We'll have some more time at the end if you have any further questions about the environment work that our representative is doing.
Yeah, no, thank you. I know that was a great question, Dawn. And super interesting about the mattress disposal too, especially as we get to September 1st. I've seen a lot of mattresses on the sidewalks in many different neighborhoods. So that was super interesting to hear about.
I have to tell you that, so I posted this on Facebook. I can send you the link. We went and we visited some mattress recycling facilities. There's a private one in Fitchburg, and UTEC, which is a nonprofit organization in the Merrimack Valley, does mattress recycling as part of their youth serving programs and roster. Like they work a lot with youth leadership and gang reduction, and they run a mattress recycling program as part of that. And it is fascinating. You can take apart a mattress and you can recycle most of its parts. And that's what we're going to end up doing in Massachusetts.
No, that is super interesting. I love that too. But okay, we're going to a little bit shift to transportation, because obviously there's been a lot of talk around public transit following the announcements of the shutdown of the Orange Line. And then also recently too, just to expand East-West Rail in Massachusetts. So I was wondering, with your district being in Western Mass, could you just tell us maybe about the state of regional transportation in the Pioneer Valley and like the regional challenges outside of the Boston MBTA service area? Because I think a lot of people don't realize the regional challenges out west.
What a great question. Well, first of all, you know, hearing about the Orange Line out in Western Massachusetts, I think we empathize, you know, because we don't have a lot of public transit. So we completely get like what happens when your public transit sort of evaporates for a month. I have to say, though, that I think that the way the administration, the governor has handled this has not been great. I mean, I understand that the 30-day suspension is going to be the equivalent of 5 years worth of work. I think that's great to be able to do it. I just wish they would have done it maybe earlier during COVID when people weren't going into work and relying on public transit. I think it's a little tone deaf in terms of how people rely on transportation. They don't have cars. So out in Western Massachusetts, some of us have cars, and others of us are relying on very skimpy public transportation. I'm really lucky in my district because since UMass is in the district as well as Amherst and Hampshire, and UMass has its own transit system, it's an operator for the Pioneer Valley Transit Authority, or PVTA. All buses in Amherst are free. So when I hear about free fares in Boston, I completely get it. It's a fantastic thing. But what we need out here is not only free fares, we need more routes. So what you see throughout Western Massachusetts are regional transit authorities that don't cross county lines, even though people have to cross county lines to go to work, to go to school, to go to the doctor, to go to the hospital. And so there's a lot of barriers to being able to get around smoothly based on a public transit system that doesn't really connect Franklin to Hampshire, to Hampden, to Berkshire County. We need more routes and we need more money. There's a great bill that was introduced this session that I'm sure will be introduced again next session by my neighbor, Rep. Natalie Blais from Southern Franklin County, which basically infuses a whole lot of money and attention into the regional transit system, which exists outside of Boston, not just in Western Mass. And this is the public bus system throughout the state. And we need to do more with that. There are way too many people who are, for example, live in Amherst, but need to get to Holyoke Community College for school. And the only way they can get there is by bus. And the bus takes them 3 to 4 hours because there isn't a direct bus there. That's too long, right? I mean, it's 3 to 4 hours to go to a 1-hour class and then come back. Think about if you have to go to work. Too many people missing doctor's appointments, going late because the buses either don't run on time or there are not enough of them to get you there on time. So that's what Western Mass deals with. So we're looking at alternative forms of transportation. What do e-bikes provide us out here? What is some of the Lyfts and the Ubers? Can we sort of integrate those out here? Because we need to get more transportation. And passenger rail service is a big piece of that. So where the buses don't necessarily go directly from Springfield, let's say, to Greenfield, we now have a north-south train called the Valley Flyer that does. So the Valley Flyer goes Springfield, Holyoke, Northampton, Greenfield, and connects to trains on either side of Massachusetts. And we need more passenger rail. So east-west, west-east is a big piece of that. Moving people from Western Massachusetts to be able to go into Boston for work, but live out here, or vice versa, is going to be huge. We are definitely seeing that move in the right direction right now, but we need expanded rail throughout the whole region going in all different directions. I think we'll see more about Boston to Springfield to Pittsfield. There's also a northern route for the train that goes Boston, Greenfield, North Adams. So we look at both northern route and southern route, as well as north-south. And I think we'll see more because I think thanks to President Biden and his love of trains and infrastructure, we'll see more funding coming to Western Massachusetts for that. So we just passed a bond bill that included $275 million to start the process of really looking at that rail, passenger rail in Western Mass. It also sets up a committee that will decide what's the best way to oversee the implementation of West-East rail. So we are definitely on the way, but we have a long way to go when it comes to public transportation in Massachusetts.
Yeah, no, definitely. I think, like you said, a lot of people don't realize people don't own private vehicles in Western Mass, or they can't just hop on the T quickly to get from one place to another. It's a lot more complicated than that. So
a lot more complicated, but you know, the bill that we passed this year that allowed people in eligible Massachusetts residents to get driver's licenses regardless of their immigration status is a big help in Western Massachusetts, because it means that people can drive without fear. And that's really important, as well as keeping our roads safe.
No, definitely. That is great, though. Thank you so much.
Thank you.
Okay, Kat, I'll pass it back over to you to talk a little bit about elections and voting and all that stuff.
All that fun stuff. We're so close to the primary. It's kind of top of mind. So you had mentioned kind of in your intro that you're currently running to be reelected to the Massachusetts House. And we would love to hear a little bit more about what made you first decide to run for state representative and what keeps you motivated to keep serving your constituents and keep running for reelection.
It's a great question. So I first, when I decided to run for office, it wasn't like I said, I'm going to run for this office. I want to do this and I want to do this right now. It really had to do with the context of what was happening with the representative for this district. So when I ran, the person who was the representative, about 3 months before the campaign started, decided to unenroll as a Democrat and enroll as an independent. And as you may know, the House of Representatives in Massachusetts is very Democrat dominated. And I was working at the Amherst Survival Center at the time. I was in my office. Lunch was happening. And so I saw many of my neighbors who had needed lunch at the Survival Center for whatever reason, either because they didn't have the money, they didn't have the food, or they wanted the company and the community. I saw lots of folks coming in for lunch. And when I first heard that the person had unenrolled as a Democrat, my first question was, how does this help the people that I'm working with right now? How does this help the people who are coming into the Survival Center? And that was the question that I asked myself, is how does this help? And I didn't think it did help, but I didn't really think at that moment that I should run. I just felt like I'm feeling like this is not going to be good for the people that I work with. This is not going to be good for people who really need a voice in the House, who need to make sure that people are thinking about people who don't have enough food. This is not good for those folks in this district. And then some folks called me and said, would I consider running? And at first I didn't. And I don't know if you know, there's this saying that women have to be asked 3 times to run before they decide to run. With all due respect to the men on the call, men wake up in the morning and say, today's a good day to run for a state rep, but women need a little bit more coaxing. I guess I needed a little bit more of people saying they saw me that way. And I also loved my job at the Amherst Survival Center, so I wasn't so eager to give it up. I really felt part of that community, and I felt like I was doing very meaningful work in that organization. And I loved the people that I worked with and for and saw every day, or saw once a month or saw once a year. But over time, I started realizing that, why not me? If I wanted to make sure that those individuals had a voice in the House, then that was sort of the option that I brought to the voter. Why not? And so I really did see myself as just an option. I had some background, obviously, prior to working at the Survival Center. I worked for a congressman when I first got out of college in New York. I worked in the AIDS epidemic for several decades. I worked with drug and alcohol treatment programs, as well as homeless shelters around HIV, harm reduction, opioid overdose. And so I had this, a perspective on what our community needed and who was in our community that I thought was valuable. And so I decided to run. And I was very lucky because I had some very good friends and people in the community who were really smart, who agreed to help me, and who formed my campaign piece for that. So, if I was going to tell anybody if you're thinking about running for office, I would say the first person you need to make sure you get, there's 2 key people you need. One is a campaign manager, and that should be someone you trust and who also knows you really well and trusts you. And the second person is a scheduler, because you don't want to be saying to all the folks you meet, oh yeah, we'll get together, and then never follow up. You don't want to say, let's see each other next Thursday, and then forget about it, and they're waiting for you and you're not there. So I think being a candidate makes you very busy. I was extremely busy because I was also still working at the Amherst Survival Center when I was running. And the two things had to be kept extremely separate. So my campaign only really happened before 9 o'clock in the morning and after 6 o'clock at night. You know, it's great. I mean, for me, I loved campaigning because I loved being able to meet new people and ask them what they expected from their rep and what they wanted from state government. To me, that was a really good education, and not just informed me, but informed every action I've done since. So.
I love that. Obviously here at the MWPC, we spend a lot of time asking women to run for office and trying to be at least one of those three. But yeah, men just on the golf course are like, I'm going to run. Thank you for sharing that advice about running for office. I have one more quick question, which is specifically for young women. Do you have any specific advice that you would want to give young women who are thinking about running for office?
Yeah, so when I look at my experience before I ran, there were things that I did in my work life that I would not have predicted would help me as a candidate or would help me as a rep, right? Because being a candidate and being a rep, they're some parts are the same, and then some parts are different. Your skill set overlaps, but it's also different. But I realize now that there were jobs that I had that have helped me be a state rep in ways that I had not anticipated that they would have. When I ran, I talked a lot about my experience in the AIDS pandemic, in the AIDS epidemic, because that was a very formative part of my life. It taught me about what my values were. It taught me about what I thought was important. And it taught me about making sure that you're always aware of people who do not have the resources to do what they need to do. And that government's job is to make sure that it's there. So for me, that experience was really critical. It really underscored the role of making sure that we're there to take care of each other, and that that makes our community a better and a stronger place. But what I hadn't thought about was, so when I was doing training around AIDS with drug and alcohol treatment providers, to me, that was I loved doing that because I loved being able to share information. I learned from the people I was training. There was a dynamic that happened. I learned about their lives and about their struggles, and I learned about how to help them do their jobs better. But I hadn't thought that the training would also help me kind of defend legislation or present information on legislation. And so I sometimes, my advice is actually do what your heart wants you to do. Go where you want to go. Because if you decide you want to run at some point, whatever you've done, as long as you followed your heart and you followed what your own sense, your own compass was saying you should do, the skills you learn in that position are going to be skills that can be transferred into either being a candidate or an elected official. So there's no real path, right? You get to create the path. You get to decide where does your heart want to take you? What are your goals and how are you going to get there? And then trust the fact that when you do that, not only I think it makes you a happier person, but I think you end up learning and picking up the skills that you need to do the next thing. So don't look for someone else's map. Make your own map. I don't know. I hope that's clear.
I love that. Thank you. I know Nicole has a few questions, and we also have some questions from the audience. So I'll let her go from there or from here.
Yeah, I think just going off of running for election too. I know in past election years, you also were involved in campaign work. You coordinated the Amherst campaign back to elect Elizabeth Warren to the Senate. And then you served as the Amherst organizer for the campaign to elect Maura Healey when she ran for Attorney General before the governor days. So with the big election year approaching this November in Massachusetts, I was wondering too, what are some ways young women can become involved in either both the local and statewide races?
This is a great, Nicole, this is such a good question because I actually say this to also high school students and middle school students. The best way to get involved in politics, if you haven't done anything, is to get involved in a campaign. First of all, you're needed. So you're going to be going into a group of people who immediately are like, we're so glad you're here. And that's a great thing to be told on a regular basis. But you'll also learn such incredible skills around the mechanics of how to build a campaign, how to connect with people, how to talk to people that you've never met before, like how to start that conversation with a complete stranger. When we canvass and you're knocking on a door and if someone opens up and you're there representing a candidate who may not be yourself, that's your first class of how do you start a conversation with someone you've never met before on a political topic. And if you do it over and over again, you get pretty good at it. So my number one advice to people is get involved in campaigns. The first campaign I ever got involved in, I was about 10, I think. And I grew up in a town in northern New Jersey. And there was a young guy who was running for mayor. And I say young, he was like 32 or 33. And most of the other people who were running for mayor were much older. And all I did was I met him once. I don't know why, but I thought I want to help him get elected. I really don't know why I thought that. I'm not sure what clicked that said, this is a person you want to help elect. And I distributed literature for him. I put literature in people's doors. And that hooked me because I was valued, first of all, in the campaign. They value, hopefully, if you're working in a campaign where they don't value, you're working in the wrong campaign. So you should change and get into a different campaign. So you felt like you were part of a bigger group of people working for the greater good. I mean, there's no better feeling than that. For me, anyway, I feel like that's the ultimate sport. That's the ultimate teamwork there. And so I would highly recommend people get involved with campaigns. I'd also recommend college students look for internships. I don't necessarily think you have to think about an internship with someone who is like-minded as long as you're open-minded and you don't have to compromise your morals or ethics to work for that person. I had internships throughout college and they were critically important to my understanding of my own values and what I wanted to do and how I felt about issues. And then I think you can dive in. I don't want to discourage people from I don't want to discourage a young woman in her 20s from waking up one morning and say, today I want to run for state rep. Go for it. But just realize that it's not going to just happen like that. There's a lot of pieces to making a campaign work, whether you're a woman or a man. And knowing what those pieces are and making sure you have them in line is a good way to succeed.
That is great advice. Thank you so much. That was awesome. I think that helps the campaign, especially. I think people don't realize how important and simple it is to get involved on an easy level. So
it's literally at this point also, it's literally going onto one of those websites and saying, I want to volunteer. And if you don't hear back from the person, contact your legislator or contact some elected official in your town and say, I want to volunteer on this person's campaign. How can I make that happen? Let me know if you want to work on someone's campaign and I'll sort of direct you to the best of my ability. But it's a great way to get involved, to get someone to get to know you, for you to get to know them, and for you to get to know their network of people, which will ultimately be a network that will help you.
No, awesome. Well, thank you. Kat, I guess since I know we're running closer to time, so maybe we can start I know we have a couple Q&A that were sent in the chat and email, and then also welcome people to continue to ask, but we can get started maybe on that.
I do have one kind of very MWPC question I would love to ask. When I was doing research for this, this conversation, I asked a friend who works in the State House, like, what do you think of when you think of the rep? And one of the things she said was she's wicked collaborative, which I think is one of the important reasons to get women elected. So I always love to hear stories about times that you've worked with other women in the building or in other work that you've done to get something passed or something done that might not have happened if you hadn't been able to collaborate.
I'm all about collaboration. I mean, I think that, there are some legislators who will focus only on their own bills and just work. And I'm not judging this at all. I'm just saying that they'll focus on their own bills. And then there are others who will want to focus on more bills. I'm much more in the latter category. One thing I learned when I got to the legislature was there are a lot of smart people already in the Massachusetts legislature who have some really unbelievably fantastic bills. And my job is really to support them and their bills to cross the finish line. I don't have to be the one that always thinks of the bill that hasn't been thought of before. I want to be one of the people who's helping to get stuff done. And so that means collaborate. So for example, the Green School Building is an example of collaboration, not only collaborating between me and Senator Comerford, but then also with the constituents who brought this to us, and then sharing it with colleagues to move it forward. Another bill, I have a bill that would ban non-consensual pelvic exams, and introduced it for the first session, last session, and it kind of made its way through the committee, but it didn't really gain traction. But this year I decided to reach out to some other legislators and see if people would like to join, and they were like, absolutely. And so it got further. It hasn't yet crossed the finish line. Hopefully it will before the end of December. But reaching out to invite collaboration is just as important as reaching out to say, I'd like to collaborate, right? So you kind of do it both ways. In the legislature, we have the Women's Caucus, the Legislative Women's Caucus. And so that's really all about collaboration, setting priorities of bills that our members have, and then working really hard to pass them. So I make it a point to go and testify on behalf of other people's bills, other women's bills, not just my own, as a way to also show support. I think that answers your question, Kat, does it?
It does. Thank you so much. Now would love to go to some questions in the chat. I know, Nicole, somebody private messaged you one if you want to ask.
Yeah. So we have a couple that people wrote in, and I had one. Obviously, in your district, you have many higher ed institutions in your district. So with the beginning of the school year, we were wondering, like, how can your office assist the important issue of sexual assault on campus?
This is a great question. So last session, we passed legislation that addressed, in part, sexual assault on campus. The Joint Committee on Higher Education advanced legislation that kind of combined a couple of different bills that the organization Every Voice Massachusetts were supporting as a way of sort of standardizing response to sexual assault across all campuses in Massachusetts. Critically important. Your question, though, is how is my office can be helpful? First of all, I see every student who's going to school in Amherst as my constituent if they live in Amherst. I know they're here for 10 months a year. They may or may not be here for the other 2 months. They may be, I'm not sure. But if you're going to school in Amherst and you live in Amherst, you're my constituent as long as you're here. You may also be somebody else's constituent in another district, but you're mine. And that means that if you are feeling unsafe in some way on your campus, potentially because something has happened to you on that campus and you don't know either who to turn to on that campus or you don't feel safe turning to them, you can come to me and we will figure out together how to go about increasing your safety. So I'm not going to presume what that may be for some people. Some people may feel like, I don't know who to go to on campus. You can reach out to me. We can point you in the right direction. I can accompany you if you need to. I can make that direct link and introduction for you. And maybe I don't feel comfortable going to speak to the person on my campus alone. I need somebody to come with me. I'll join them. It may be, I don't know, I'm trying to think other kinds of things that I've actually gotten involved with. And maybe I need that the person would like to be able to reach out to be able to get counseling. I can help facilitate that and refer them to counseling on their campus. So if you don't feel comfortable or you don't know who to go to on your campus and this has happened to you and you are going to school in Amherst, please call me. Can I give my number right now? Is that all right? And I can also put in the chat. It's 413-335-1362. I'm going to do that again, and then I'm going to try to find everyone in the chat, which isn't coming up right away. But it's 413-335-1362, or my email, which is Mindy, MINDY .Domb, DOMB at mahouse, one word, mahouse.gov.
That's so
And, you
great.
know, there have been situations in the past where people were unhappy with the way a school was addressing it. And I'm also here to help get involved and advocate for them in that area too.
No, thank you. That is so great. We can maybe, Kat, if she can't find the chat, maybe we can put it in after, email everyone that attended to with all that info so they have it.
I'm going to do it. I found it. So
Okay, perfect. And then, Kat, do we want to ask maybe one or two more questions? I know we're closer to time, but if you have the time, we could do maybe like one more.
Let's do one or two more.
fine with me if it's okay with everybody else.
Okay.
Perfect.
Here, Kat, let me pull up. I had a list of some people wrote in. So kind of switching over to public health too. So based on your career, like you mentioned, you were an advocate, huge on the HIV epidemic. So wondering too, how can Massachusetts be a better leader in public health, especially during times of pandemic and outbreak?
Well, this is, we are not doing a good job in public health, but we're not alone. I mean, for whatever that's worth, I think across the country right now, public health is really deeply suffering. We've sort of have forgotten the role that public health plays, and we're relying on individual health and individual assessment, probably to our detriment as a community. And so, first of all, there was this great legislation that was introduced by women in the House and the Senate. It goes by its acronym SAPHE 2.0. It's like Standards of Excellence for Public Health. The people who filed it, just so in case people are here from their districts, were Representatives Denise Garlick and Hannah Kane and Senator Joe Comerford. And the bill was fantastic. It was a way of the state supporting local public health. So relying on local public health to do certain activities and efforts, which we currently do, but making sure they have the resources to do it. Sadly, the governor did not sign that bill before the end of the session. And so we're going to have to revisit that next session, hopefully at the beginning of the session, and pass it so that it becomes law. But I think that, you know, when I first moved to Massachusetts, which was a while ago, and it was during the beginning of the AIDS epidemic, Massachusetts public health system was famous in the country, renowned for being active, aggressive, effective, meaningful. But I would think in the past couple of decades, we really have starved the Department of Public Health. We have robbed it of resources. And as a result, we haven't been able to think imaginatively and big about what we can do. And unfortunately, what happened during the pandemic is then we got caught with this, you know, once in a lifetime global pandemic where we needed to have testing site infrastructure, reporting, data collection, prevention, and we scrambled. Out here, we were lucky, I'll tell you the truth, because we had UMass Amherst who stepped into that void, and with their students from the nursing school, as well as from public health and public policy, they popped up an incredible testing infrastructure. But look at what happened in the state when we tried to do that, right? The governor set up a testing website that crashed the first day. We knew that we were going to need for the vaccine website. We knew that older people were going to be the first that were going to be required to get vaccines. And what do we do for scheduling? We made it internet-based. Older people weren't the most fluent when it came to using computers and technology, and we made no allowances for that. We had to scramble to make sure. All we had to do really was talk to senior centers and say, how can we do this? They could probably have told us exactly how to do it. We would have been able to do it without it breaking. So I think in Massachusetts, we have a ways to go, unfortunately, with public health, but it's the same thing across the country. I look at what's going on with the CDC, and it's heartbreaking, actually, to see institutions that were really revered and also trusted, not trusted at the moment. But we need to reinforce it. We rely a lot on local public health to do a lot of the efforts and activities that we need but we don't give them the resources, and that's funding, technology, staffing that they need. And in Western Massachusetts, to your question a while back, Nicole, that's really critical because we're talking about rural communities that may not even have a health officer being required to do reporting, data collection, prevention with no resources. So we need to be able to make sure that wherever you are in the state, public health is excellent, it's available, and it's well-resourced. And hopefully next session, we'll pass that bill, and that'll be a good step forward to do that.
Yeah, no, definitely. And then just kind of going off of the public health, I swear this will be the final question. So going off of that too, do you also think it's important for Massachusetts to have a harm reduction approach to public health? I know this session, several bills related to safe consumption sites were filed, and I know the Western Mass delegation, including yourself, were strong supporters of this idea. And just maybe if you could explain a little behind these types of programs, and yeah, if Massachusetts should do this to public health.
Absolutely. And I am a big advocate for harm reduction. And a lot of that comes from my work in the HIV/AIDS epidemic. So, harm reduction basically started with, believe it or not, cigarette smoking and alcohol consumption, where we had certain treatment programs that expected people who were using those substances to be able to stop immediately, like to go from 60 miles to 0 without anything in between in terms of their own use. And for some people that's possible, but for most people it's not. For most people, treatment and recovery happens, it's iterative, and people kind of continue to learn about what makes them better at succeeding at it. So they are able to do it for a while, but there's something called relapse, or they may go back to using. They may not be even going back to using at the same level that they were using before, but they go back to using. They learn about what prevented them from continuing to not use, and then they can go back in. And I'm a big believer in harm reduction because this expression that's gotten a lot of play in the past couple of years is basically the premise of harm reduction, which is meet people where they're at. That if you tell people we need you to do X, Y, or Z, well, they may do it for a while, but it's not a long-term strategy. If we want people to adopt long-term behavior change, it has to come from within. And when it comes from within, that means we have to go and say, how can we support you to do it? So that's a general kind of spiel on harm reduction. We could go on a whole nother session just on harm reduction, but there are some harm reduction programs that we already do in this state and in this country. I just want to point out, seatbelts is a form of harm reduction. Bicycle helmets are a form of harm reduction. Condom use during sexual activity is a form of harm reduction. It says that activity that you may be practicing, whether it's riding a bike, getting in a car, carries a risk. And that risk is for harm. How can you reduce the harm if you still face that risk? That's basically what it's all about. So in the AIDS epidemic, there became a lot of different kinds of harm reduction programs to try to address behaviors regarding sexual behaviors and drug use behaviors. And primarily when it concerned drug use behaviors, we started syringe access programs because HIV was spread by the sharing of needles. And people shared needles because they didn't have access to clean needles. So syringe access programs basically provide access to clean needles, but not just clean needles. They end up having a whole series, a whole roster of public health services that are available at the same time. So they could have access to condoms, they could have access to drug treatment programs. And because we weren't judging the people that were using drugs as being bad people, just that the behavior was potentially unhealthy, guess what? People respond to not being treated like bad people. They respond positively. And so we found that a lot of people actually were receptive to referrals to drug treatment programs through syringe access programs. And we saw through syringe access programs that drug use didn't increase. We didn't see people start to use drugs because all of a sudden they could get needles. And we actually saw more people going to drug treatment. So through syringe access, we started to see that harm reduction was actually effective in reaching other public health goals. So the social consumption sites that you talk about, or the safe consumption sites that you talk about, are about providing, and they do this in some places in Europe, they provide a space that's safe to use, which is not just a place that's safe to get a syringe. It becomes a place that's safe to use, that has a public health nurse available, that has somebody with Narcan available. So in case someone overdoses, they can be rescued and they can be reversed. It also is a public health nurse to help a person prevent infections. And it also has, nutritious food, resources to treatment programs, et cetera. And in the places where they have safe consumption sites, they don't see an increase in drug use. Like, I think that's the big fear, is that if you provide a needle or if you provide a space, then you're going to somehow lure people into using drugs that might not have used them before. The research doesn't show that. The research shows that you're not increasing drug use and you're not creating new users. You're just providing a safe place for somebody to use. And ultimately, you're preventing overdoses or reversing overdoses and linking people into treatment and care. And so I am a supporter of them. And I'm a supporter of the legislation that the state has before it right now that would set up a pilot program, because I think it's a perfect situation for a pilot program to test all of our worries and our concerns and see if they come to fruition or not. And then to be able to create programs from that. That's how we did syringe access in Massachusetts. It started as a pilot program. And when we saw that it wasn't increasing drugs, it wasn't increasing the numbers of people that were starting to use drugs, we built it out from the pilot. So I am a big supporter of those.
No,
Did I
awesome.
give you too much? Not too much.
No, this has been so great. Kat, I know, just to kind of end, since we're coming to the end of the event, I know we like to end on a lighthearted, fun question. So I know, Kat, we had one if you want to ask it.
Absolutely. Well, it's summer. So we are wondering, outside of, formal sessions at the State House, which is a great summertime activity, what is your favorite summer activity?
Oh, my favorite summer activity. I think my favorite summer activity is, well, being outside for sure. Usually hiking, but also hanging out in my garden, I have to say. I don't really have a great garden. I have a kind of a wild garden. I don't really weed it or anything like that, but I like just going out there, and I like seeing butterflies and bees and birds. I used to love bird feeding and doing that until bears, and now I don't do that. So that's a little sad for me, but I love being outside in the summer. Thank you for asking that. Can I just say, I think Freddie might have had her hand up, and I just want to make sure.
Yeah, Freddie K is here, who's the founder of Suffrage 100 Massachusetts, one of our great partners who had a triumphant event today at the Swan Boats. So Freddie, question?
Thank you. I'm sorry I was late. I'm still sort of recovering, just unloaded the car and all that good stuff. But thank you for doing this wonderful event. We're so thrilled that you all are partners with Suffrage 100. I was just going to say, Representative, that Denise Garlick is my rep. So I'm thrilled to know that you're working together. That's awesome. And I wondered, dare I ask, why did the governor not sign it?
I think I don't know. There's a lot of things that happened at the end of the session that I don't think were the legislature's fault. And it's been painted as the legislature's fault. And I hate to point the finger back at the governor, but there you go. I'm going to do that. If I can read a bill in a night, he should be able to read a bill in a night and figure out what he's got a problem with and what he doesn't, right? It's not that hard. And these bills have been cooking. So you kind of know what's going on. So I'm not sure why, but I do know that there is a very big commitment to follow up with that legislation. So, and that's not the only one. There's other bills. So we'll be going back. We did override him a couple of times. The climate bill, I don't want people to forget, the climate bill passed because we refused his amendments. And there was a lot of pressure put on him on social media to sign the bill. And then, the president came to Massachusetts and talked about how great our wind program was. And then they passed the federal bill. So there was no choice, right? Because if you were concerned about the climate bill because you didn't know where the money was going to come from, the federal government answered that question. So I think it's just a matter of working the bills. And I love Rep. Garlick. She has been such an incredible support to me, and she's so smart, and she's just so knowledgeable about the building and so generous and gracious with her guidance. I am a very lucky person that I get to call her and ask her questions and get answers. And you're lucky because she's your rep.
I agree. So can I quote you? I definitely want to tell her if I might. So that's lovely.
Absolutely. I think
Lovely.
she's phenomenal, really.
That's so
sweet.
great. That's wonderful. We do know that here. So but it's great to know that, to hear that from you. So thank you. And it sounds like the governor didn't articulate any particular, it just didn't happen.
Yeah, I think that yeah, maybe he was able to not articulate on a couple of different ones, but we'll come back. And
Okay.
that happened, early on, that happened with a couple of bills that they didn't get passed before the August recess. And then when we came back in January, they were some of the first bills that we took up. And then we were in a good position to make sure that they got passed. And so that'll happen again. There've been several times that we've had to do that with the governor, and I suspect we'll do this again. And then the next time we'll be dealing with a different governor. And hopefully we'll be dealing with a Democrat woman governor.
Good. Thank you so much.
Thank you so much.
Work and all your work.
I think you're one of the luckiest constituents to have Denise Garlick as her.
That's so cool. I can't wait to tell her that. And I do feel that way. So thank you.
That's the best.
Yeah.
Awesome. Well, thank you so much. I think I'm just checking to make sure no one else has written in the chat or questions, but no, thank you, Representative, so much for taking the time. We appreciate you, especially, I know, after a busy session in the end of August, for taking the time to jump on a Zoom with us and talk through all these important issues, especially with the primary upcoming. Kat, I don't know if you want to say anything too as your last.
Thank you so much for coming, Representative and Freddie and everybody in the audience today. We love having these events and are really glad that we get to have them with all of you. So thank you so much for being here. One quick note, do mark your calendars for September 20th. We're having an exciting town hall event with a number of our sister organizations. More information forthcoming, but make sure you mark your calendars.
Thank you. And thank you so much for inviting me and including me. And I look forward to our continuing conversation.
No, definitely. Yeah, thank you. And everyone have a good night.
Thank you.
Good night.
Night.